Hi guys, this is Dr. John Suber, plastic surgeon. Welcome again to Straight Talk on Plastic Surgery. Today's question concerns swelling after tummy tuck. Swelling can occur in nearly every patient after abdominoplasty. In my preoperative consultation, I tell patients that they can usually expect some degree of swelling for typically 3 to 4 months. That can be shorter or longer depending on the physiologic variances of a given individual patient. Patients who have massive weight loss and have had more extensive tummy tuck procedures tend to swell more, as common sense would dictate, and those with more minor versions of tummy tuck tend to swell less, generally speaking. If swelling is an issue for you particularly, have this discussion directly with your plastic surgeon. He may intervene in one of several ways. Early on, the compression garments and the drain placements that are typically part of an abdominoplasty will manage most people's swelling. In my practice, most patients that get tummy tucks get 2 drains and are in a compression garment of some form for several weeks. I have a long discussion with my patients preoperatively about what to expect regarding swelling. I even bring up the issue of seromas. Seroma is simply, in layman's term, a fluid collection between 2 tissue planes. What does that mean? Well, when you do a tummy tuck, you're making an incision down low and you're elevating up all this skin off of the abdominal wall musculature. It's almost like you're standing at the hood of a car and you lift up the hood of a car and you're looking at all this muscle. That's a lot of space there that has to heal back after your procedure's complete. We plastic surgeons note that a tummy tuck is the largest randomized flap that we perform as plastic surgeons. It doesn't have to mean anything to you, but suffice to say that swelling can be a significant part of tummy tuck, and it should be discussed fully with you by your plastic surgeon preoperatively. Again, most of the time the drains and proper compression garment under direct supervision of your plastic surgeon will manage this effectively. In my opinion, and in my patient population, I have anecdotally, that is in my experience, seen that one subset of patients particularly tends to have more protracted swelling issues than others. First off, I think the massive weight loss patients tend to have more swelling, generally speaking. But in addition to that, patients who have had swelling issues prior to surgery or have had to take water tablets or diuretics before surgery tend to be what I call third spacers. They tend to like to dump fluid in these tissue planes after surgery. So I anticipate that they're going to have a more protracted swelling course. So in those patients, I may leave drains in a bit longer. I may be very specific about instructions regarding compression. And these are the patients who oftentimes will have to have seromas or fluid aspirated from between these 2 tissue planes in the early phases of post-op recovery. That is not a big deal in my hands. Typically, the seroma fluid is drained off by your plastic surgeon, and whether or not that needs to be performed is a direct decision between you and your individual plastic surgeon. So again, a sidebar here is that all this responses are general in nature and need to be confirmed with your specific plastic surgeon as it relates to your medical history, physical exam, and the specifics of your surgery. Now, some patients will have protracted swelling. One viewer has had protracted swelling and has had many of the common tools applied to her that are used to manage swelling. Long-term out, things such as lymphatic massage can be used. In my hands, that's more of a thigh swelling issue after thigh lift or liposuction, but it can be used for the abdomen as well. Aspiration of seroma or attempted aspiration can be part of that equation as well. One way to know whether you have genuine post-operative swelling or if you just have redundant tissue remaining after the procedure, in my opinion, is seeing a variability in that swelling during the day. In other words, it may or may not be so bad in the morning, and then during the day, as things progress, the swelling will increase. Or if you're out of your garment for a length of time, you may see that swelling increases. That is day-to-day swelling in my hands, and that typically will resolve with time. Now, Protracted swelling can be a bit of a different issue. In other words, when that fluid that's been between these two skin planes is present for after a period of time, there's a wall or a cyst wall that can form around that pocket, and at that point it's harder to have this go away on its own. Sometimes your plastic surgeon may order certain tests to study this. An ultrasound or even a CAT scan can be used to isolate, locate fluid pocket, and identify it. Radiologists are sometimes even trained to place a drain under direct radiological vision so that this pocket can be adequately drained if your plastic surgeon is not able to access that pocket in the typical way. So sometimes that is necessary. A last resort for protracted swelling where a known pocket of fluid exists sometimes requires reoperation. What has to happen is that pocket is accessed and opened. The lining of that pocket, the material that lines that pocket, is either removed or scarred down, and sometimes what's called quilt stitching, which would then secure the top layer of tissue of the skin down to the muscle underneath, in the case of a tummy tuck, may be part of that procedure to obliterate or get rid of that space. So in summary, if you're having protracted swelling, you may want to discuss with your plastic surgeon about radiographic studies that may or may not help identify any lasting swelling. Don't forget about diet, and most importantly, discuss this thoroughly with your plastic surgeon. A specific visit with him that relates directly to your medical history and physical exam and course thus far post-op will be your best answer. Most plastic surgeons, including me, with protracted issues like this, do not mind having you go for a second opinion to another well-experienced, well-qualified plastic surgeon just for a second set of eyes. That doesn't offend me if that occurs in my practice, and I even encourage it sometimes just to give patients peace of mind. But swelling can be a long-term issue, and all of these issues are general and should be addressed directly with your plastic surgeon. Thanks so much for the question. I hope this helps. And remember, no matter where you are, life is good.